Hello guys, this is Rebecca Wankoba. Welcome back to my YouTube channel. Today I'm going to be talking about family planning. And we know family from the words, it's from the words themselves. Family and planning. Family is usually the basic unit of a society that consists usually of the father, mother, and children. Then planning is how best is one supposed to do spacing of the number of children for them to have that healthy family, to have the spacing, to have children grow healthier, to have the mother's body rejuvenate the cells that were worn out during delivery, and also for psychosocial support, the mental health of the mother. So family planning happens in hand with contraceptives. Contraceptives, these are drugs that help reduce chances of one getting pregnant. A number of contraceptions, we have the hormonal and the non-hormonal. There are those which take longer duration, like 3 months, 3 years, and 5 years, or even up to 10 years, for them to enable one space the number of children they want and the period. It all depends with a given family and the understanding between the woman and the man. So among the hormonal, there are 5 types of hormonal contraceptions. This means they contain substances that it does not mean that these substances are not in our body. Normally, the human body is made of hormones. So these hormonal substances, they just enhance the prevention of pregnancy in a given amount. They contain the hormones in certain amount that help prevent pregnancy. So among the hormonal contraceptives, we have the pills. We have this pill, Chaguo Langu. I know most of you have seen that. Chaguo Langu that has 21 pills. It is a cycle of 3. It has 21 pills that go for 3 months. Normally the pills are like this for 21 days. After one comes to the hospital and they are given these pills, they are given direction. Also the pill has direction. One is supposed to take from day 1 to day 21. Then on the 20, after the last pill of that cycle, one rests for 7 days. That is when the menses are supposed to be flowing. That is when one experiences the menstrual flow. Then after 7 days, that is on the date 28. On the 28th day, they get in the second cycle. By the time one starts the second cycle, it means the periods have stopped, and also one is ready now to continue with the cycle. These ones, in other terms, the Chaguo Langu is usually a combined estrogen and progesterone, combined oral contraception, combined from 2 types of hormones, estrogen and progesterone. Oral contraceptive. It's a drug in form of tablets. Also, there are people who may indulge themselves into sexual intercourse and they may not want to keep the pregnancy, or they were not in their safe days. This one is usually taken as an emergency pill. 4 tablets within 72 hours in 2 divided doses. Another type of a pill that we have is levonorgestrel. This is only a progesterone-only pill, contains only progesterone, and is usually given to breastfeeding mothers. It has 3 cycles for 3 months also. One goes for 35 days. When one completes one cycle, they immediately start with the second one because it only helps in breastfeeding. only given to breastfeeding mothers because it helps them reduce chances of them getting pregnant. We only have 2 types of pills, which are hormonal. Another class of hormonal, we have the rods. Usually we have the 2 rods and the 1 rod. 1 rod goes for 3 years. It's a long-term method that lasts up to 3 years. It's called an implanon. The 2 rod, it's known as a jadel and goes up to 5 years. So what do we mean? When one chooses a long-term method, it does not mean they will have to wait for the 3 years or the 5 years to complete. If one wishes to get a baby within the second, or if it's a 5-year method, if one wishes to get pregnant in their 3rd year, they just visit the hospital, they visit the hospital, all tests are done, the necessary tests before removal, and they explain themselves that they want to get pregnant, and it is removed. So one does not just have to wait for the long-term years to complete. Then we have another hormonal method, that is depo or medroxyprogesterone. Most women go for injection, that is the depo. It usually looks like this. It is liquid in it. It has 150 milligrams. This one contains only progesterone. That is why it is called medroxyprogesterone. It usually comes in a sachet that looks like that, of 25 pieces. This one is injected after every 3 months, that is 84 days, is when one is supposed to come for the next injection. So basically that is about the hormones. And remember, these are drugs. Drugs that contain substances that come into, when one swallows or they are injected, they help prevent one from becoming pregnant. Remember, every drug has a side effect. So hormones, these are substances that are introduced into the body. And also even when taken either orally or inserted, remember they are foreign substances. There is some reaction to that. That is now the adverse effect or the side effects. For example, when you have an injection like this, depo, most women or many women may gain weight, increased weight. And with the increased weight, we have some who come complaining of headache, nausea, increased menstrual flow or reduced, or some don't get any flow, which is mostly found in most hormonal methods. The methods that we've talked about, the increase of flow, it can be normal or just the normal or not at all. So when there is increased flow of menses, some women come to the hospital and they complain of bleeding for 30 or 28 days in a month. That is not normal, it's an abnormality, and is usually termed as menorrhagia, when there is increased menstrual flow and changing up to 8 pads in a day, which are full. So does it mean that when the method has some side effects, one ceases to use them? No. There are techniques that have been used initially with research. It has been found that women using these hormonal methods most likely you will find when they react to one, they are likely to react to other methods, which are hormonal. That is like the implants or the gel, also the pills. So it is usually advised that when a woman comes with such complaint, they are treated twice before making a decision of removing. So the treatment for increased flow of bleeding, we usually have brufen that looks like this. One takes 4 tablets 3 times a day for 3 days. This one is not taken alone because it will not help. It is taken in combination with chaguo langu, which is also known as the COC, plus an injection. This one is taken for a whole month. This one is taken 4 tablets. 4 tablets 3 times a day for 3 days. This one is a whole cycle of 3 months. And an injection, which is given once. When one starts swallowing the pills, it is given together with an injection that is given only once. That is tranexamic or hemsamic acid. 10 mils, that is 1 gram. Either deep into the muscle or through the vein. With that, any other woman who comes with bleeding or that woman who has come with bleeding, they get sorted for the rest of the time that they want to use the contraceptives. Going to the non-hormonal methods, we have a withdrawal method. When a man feels that it's time to release the sperm, they remove and pour it outside the vagina. Then we have a long-term non-hormonal that does not contain hormones. This is called copper, usually known as copper T, lasts for 10 years. The longest long-term method of family planning. But in as much as we have side effects, this one, when a woman is inserted the method, they are highly recommended to have high levels of fidelity. 1 man, 1 woman. Reduce chances of infections. Because when one gets an infection, it will not just be removed immediately. They will have to be treated, both she and the partner, before removing. Also, as pertains fidelity, their immunity should not be compromised. They should be very healthy. Because when one has this, you see it's an external organ that is inserted into the human body. One may tend to have chances of infection. It is the safest method that goes up to 10 years, and because it does not have side effects of headache, weight gain, the only risk it has, it's infectious rate. And the moment one gets to use the IUCD, the copper T, they are advised or counseled together with the partner before insertion, and they are advised to be faithful to each other so as to reduce the chances of infection. If one gets infected, you are treated first together with your partner before it is removed. Another non-hormonal method is the condom. This one helps prevent, it's the only method of contraceptive that helps prevent against HIV/AIDS and STIs, and pregnancy. So this one has the high advantage. There are different types manufactured by different companies, help prevent HIV and AIDS, plus sexually transmitted infection, that is STIs, plus reduced chances of one getting pregnant if it is correctly used. So basically that is what I was to talk about, family planning and contraception. Thank you so much for listening. Kindly subscribe to my channel and press the notification bell below. Welcome and bye.